Aloha and welcome. I'm Dr. Taketa-Wong. Uh, I'm a physician who believes that educating patients about their health is an essential part of a doctor's mission. Many of you have probably heard of CBD oil and medical marijuana. Today I'll be explaining about the differences and their potential uses in medicine. CBD stands for cannabidiol, which is a compound in the cannabis plant. Here's something many people aren't aware of. Our brain actually makes cannabidiol and other similar compounds naturally. They are called cannabinoids. They regulate things like mood, appetite, and pain. In other words, as many other compounds in our body, nature thought that cannabinoids were so important that we come with them built in. So when we take CBD or marijuana, it is working through the system in our brain that naturally makes and uses these compounds. If you have a comment or question, please go ahead and put it in the comment section as we go along. Now, for those who are new to our events, I'm a naturopathic physician, or ND, and like medical doctors, I attended a 4-year medical school. I was trained as a primary care physician, so I order lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there is much more. Naturopathic doctors are trained to place nutrition at the forefront of diagnosis and treatment. This is especially true when it comes to medications. It amazes me, but even today, fewer than 20% of our medical schools require any courses in nutrition. Of those, the offerings are usually fewer than 25 hours in 4 years. Naturopathic doctors typically receive 155 hours in order to be trained in the power of nutrition to build health from the inside. Applying that knowledge to a patient's condition, whether it's autism or PMS, takes a lot more time than prescribing pills. My office visits are a full hour. In addition, I'm also a licensed acupuncturist trained in Chinese medicine, which gives me another powerful medicine tool. 3 pillars form the foundation of my practice. They are to heal, to educate, and to empower. Today's event is a perfect example of those pillars. You will learn how CBD and medical marijuana each have a place in the medical field and how they can safely help people with certain conditions that includes seizures, cancer, anxiety, depression, insomnia, pain, and hyperactivity, both in autism and ADHD. They may also play a role in regulating the immune system as well. Whether CBD oil or medical marijuana, they both come from the cannabis plant. Cannabis has many different species and strains. Some are classified as marijuana and have a component called THC. THC is the element that causes intoxication and has a risk factor for addiction, a potential side effect of its use. However, for certain conditions, THC has a higher potential for therapeutic benefits, so medical marijuana may provide more effective treatment. The more commonly used form of cannabis in my practice is CBD oil. And again, CBD stands for cannabidiol, which is typically taken orally. CBD oils are labeled full spectrum. So the CBD oils that are labeled full spectrum have a naturally occurring amount of THC, 0.3% or less. That conforms to the legal limit and allows CBD oils to be purchased over the counter and does not require a marijuana card in states where you do require marijuana cards to be able to use medicinal marijuana. There are no intoxication properties with CBD oil, even at high doses, even when they're used at high doses for conditions like seizures. Some people need to be sure that there is no chance of even a tiny amount of THC in their system due to their work requirements. So some CBD oils remove all the THC. The trade-off is that the substance may be less effective if all the THC is removed, but that depends on the condition that it's being used for. However, in some cases, people don't notice any difference. I've had patients ask me about the difference between marijuana and medical marijuana. Aren't they the same plant? Yes, they are. However, medical marijuana is grown to produce a particular amount of THC that can then be measured. Whether it is used orally or smoked, it can be dosed appropriately like any other medicine. What's important to remember while I'm discussing these medicines is that my patients and I are in a partnership for health. My protocols and guidance added to their commitment to improving their lives enables them to be empowered with their health. That means they learn how to heal their condition, how to feel more energetic, and how to be happier. As you're viewing this and want to talk with me, just call or text our office to schedule a free phone consultation with me. There's no charge because we don't take patients without talking to them first. I always want to make sure that what I do fits your needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. As a quick side note, if you are looking to purchase supplements, they need to be ones that are laboratory tested for quality because supplements are not regulated by the FDA. So please visit our trusted online supplement store. All the products are tested by third-party laboratories, and it's also the only one where all the proceeds go to supporting treatment for children with special needs. You'll also receive 20% off of the regular prices. It's at drtaketa-wong.com. That's drtaketa-wong.com. You'll also find the link in the post with this video. In my practice, I typically prefer to start treatment with CBD oil. Depending on the condition, if that is not working well enough, then I may recommend medical marijuana and refer them to other physicians to be able to have the certification for medical marijuana, as that is required in Hawaii. With children, one of the most life-changing uses of CBD oil that I've seen in my work, especially those with autism, is with seizures. It has definitely made a significant difference in reducing the frequency and severity of seizures. I've seen it be helpful for adults with seizures as well. For many patients, CBD oil has allowed them to be able to decrease the doses of pharmaceutical seizure medications, and sometimes dramatically. It can also reduce the need for other pharmaceutical medications that are used to treat other conditions as well. CBD oil has also proved effective in autism when children have aggressive or violent behaviors towards others or themselves. Some children will bite their arm, bang their head on the floor or wall, hit their head or their tummy with their fist. The CBD oil often will help to calm the child and improve their behavior. However, I want to emphasize that I don't believe it in using it as the sole solution to the child's medical problems. I always look for underlying causes. Even if CBD oil helps with behavior, there could be inflammation in the brain or gut or acid reflux or other medical problems that are causing the behavior. CBD oil is not a substitute for laboratory testing for each individual along with my specialized medical treatment. Another use for CBD oil is with oppositional and defiant behavior. I know sometimes children, and especially teens, can be a handful by nature. That can be a part of the maturation process. But there is a major difference between kids being kids and a diagnosis of oppositional defiant disorder. I'm talking about situations that are extreme. These children are extremely volatile, violent, aggressive, and hostile to anyone in authority. If you tell them not to do something, then they must do it. If you tell them to do something, they have to not do it. And it's a reactive impulse that they often cannot consciously control. What's going on with children like that is that there is an imbalance in their neurotransmitters or their brain's chemical messages. Sometimes it can stem from issues with gut bacteria, even in children without autism. I do the same kind of workup either way. It essentially stems from problems with the brain and is not due to poor parenting. Because the behavior is often the result of imbalance in neurotransmitters, I have definitely seen an improvement with CBD oil. It calms them so they're not as extreme and can be more in control of their reactions. CBD oil can also be helpful for anxiety, insomnia, pain in general, and for OCD and hyperactivity in children with autism and ADHD. Early research suggests that CBD oil may help with autoimmune conditions. The research is not conclusive, and I haven't seen it make a huge difference, but it does seem to be helpful for certain conditions and may help to regulate the immune system. I want to transition now to talking about medical marijuana. One of the conditions that responds to medical marijuana is cancer treatment, particularly when it involves chemotherapy. Chemo causes pain, nausea, vomiting, and lack of appetite. I've had patients who have found that medical marijuana makes a huge difference while going through chemo. Their pain was more manageable, they rarely had nausea, food was appealing, so they were able to keep their weight up. People with chronic conditions like low appetite or who struggle with weight gain may also find medical marijuana beneficial. I've also had cases of children with autism involving extreme violence having to be given oral medical marijuana because nothing else was working to calm down their brains. These are children who are a significant safety threat to their parents, themselves, and others. The family may be fearful for their child's and their own life because the child is not sleeping, beating up family members, injuring themselves, destroying the house. I want to emphasize that these are cases where the family typically has tried everything else. The child may not tolerate antipsychotic medications, and high doses of CBD oil may not be enough. And it is a risk-benefit decision medically. Yes, there are some risks with children or teens taking medical marijuana, but if that's what's going to bring safety to the family and to the child, then it may be worth it. Also, there are some cases of anxiety where if CBD oil is not effective, medical marijuana may help. I trust our discussion about CBD oil and medical marijuana has been useful for you. You're welcome to talk with me personally about any health concerns that you have so that you can feel empowered with your health. If your doctor doesn't have the time to educate you like we're doing here today, you're welcome to talk with me personally about any health concerns that you have so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because neither I nor my associate, Dr. Anderson, takes patients without talking to them first. We always want to make sure that what we do fits your needs. You'll find all the contact information on our Facebook page and a link to our online store in the post with this video. Mahalo, and I look forward to being with you in another 2 weeks. Aloha.